So for folks that just joined, welcome to From Data to Action, supporting students with behavioral and mental health challenges. My name is Kat Merkel. I'm with NCII and I'll be facilitating, but we have three really great presenters here, and I'll have each of them just come off mute and introduce themselves real quick, starting with Dr. Allison Bruhn, and then we'll go to Dr. Elizabeth Talbott and Dr. Nathan von der Embse. So, Dr. Bruhn.
Sure. Hi, everyone. Happy to be here. My name is Allison Bruhn, and I'm a professor of special education at the University of Iowa. I'm also the executive director of the Scanlan Center for School Mental Health. And my work over the last 15 years is focused on intervention and assessment for kids with or at risk for EBD.
I'm Betsy Talbott, Elizabeth Talbott. I'm at William & Mary in Williamsburg, Virginia, and I've started my career working with adults in psychiatry, and that led me to work with kids in education. I was a special education teacher and a fourth grade teacher in Virginia. I spent a good proportion of my career in Chicago, though, at the University of Illinois, so I have really urban and rural interests in serving individual kids with disabilities. Thanks for joining us.
Hi, everyone. I'm Nate von der Embse. I'm a professor of school psychology at the University of South Florida. I'm also co-executive director of the School Mental Health Collaborative, which is a multi-university research and technical assistance center. Like Allison and Betsy, most of my work is in the school mental health domain, really around improving decision-making and how do we improve equity and access to high-quality mental health supports. Thanks for being here.
Awesome. Thanks, all. I'm going to turn it over to Dr. Bruhn to get us started on our webinar.
Thank you. So to start us off, I just wanted to make sure that we were all on the same page around what school mental health actually means and why it matters. So when we talk about school mental health, we're really talking about the social, emotional, and behavioral skills that allow students to function effectively in schools and be good, productive citizens. So the social, meaning how we interact with others, the emotional being how we think and feel, and then the behavioral, how we actually act. And collectively, those three things really contribute to how students do in schools. Unfortunately, what we know is that 1 in 5 students experience mental health challenges. And recent data over the course of 10 years from the Youth Risk Behavior Survey report have indicated that almost 40% of high school students are experiencing persistent feelings of sadness or hopelessness. And 2 in 10 students have considered attempting suicide, while 1 in 10 have actually attempted suicide. And so those numbers are really, really alarming. Also important is that 50% of all lifetime cases of mental illness begin by the age of 14. So when you look at all this data together, what that really means is that we have kids who are sitting in school even before middle school, even before high school, as early as elementary school, who are experiencing significant social, emotional, behavioral challenges. Unfortunately, only about 20% of students receive mental health services, and of the students who receive these, schools are the most common location for services, which is, I think, is pretty interesting. But in some ways, it makes sense because students spend a majority of their time in schools, and schools are often a source of support for kids because they offer an opportunity for kids to feel connected, to cultivate belonging with their peers. It's also a consistent place for students to go to have just basic needs met, from physical needs to nutritional needs to, of course, their social emotional needs. And then finally, many schools implement a multi-tiered system of support that prioritizes clear expectations, positive social interactions with peers and adults, interventions that are matched to need, and importantly, data-driven decisions. And so those things, when done well and done with fidelity, can be a huge boon to kids who are experiencing social, emotional, or behavioral issues. Most of you are probably familiar with the multi-tiered systems of support. So whether the system is focused on academics, behavior, or mental health, or a combination, one of the consistent elements is database decision-making. So that can be anything from screening to diagnostic measures to progress monitoring assessments, fidelity assessments, and all of those data are used to drive decisions. And so what we're going to talk about today is what that looks like at all three tiers as it relates to school mental health. So again, the social, emotional, and behavioral skills and supports in schools. So with that, I'm going to turn it over to Nate to talk about tier one.
All right. Thank you so much, Allison. So when we're thinking about database decision-making at the tier one level, one of the first things that practitioners, researchers, and alike should be considering are what are some really barriers to some of the effective practices that are happening within schools, certainly within school mental health. And so despite lots of evidence out there, randomized control trials, these online clearinghouses of kind of what works, we've known for a very long time there exists a pretty persistent research to practice gap. And so some of the solutions that have been proposed for school-wide implementation, especially at tier one, are these things like research to practice partnerships, things like technical assistance. And really what happens is when those things are removed, really the implementation of tier one practices and other practices in schools, they typically fail to maintain that initial effectiveness. With regards to kind of how we're thinking about other ways to implement highly effective practice. A common way to do this is, of course, finding research evidence in support of a practice. So an outside technical assistance consultant or some kind of source would say, this is something that you should do, right? There's evidence in support of practice X, Y, or Z. And this is how you do it. This is usually done through implementation science, measurements of fidelity, but so often that really ignores the individual and local reality of that school. In other words, what could we do versus what should we do? And so we've got lots of things within the research evidence about what works, how it works. But one of the common challenges that schools experience is, well, does this work for my kids, my teachers, my school that we serve? So when we're thinking about kind of how are decisions made, most districts, when they think about how decisions are made within a school, they more often than not will rely on district data or trusted colleagues. The use of peer-reviewed evidence or outside research is somewhat limited. And when they do, it's often adapted from outside services. I show the cartoon from the New Yorker. It's a famous cartoon from the 1970s. It's called The View from 8th Avenue. And looking out from 8th Avenue, a New Yorker might see 9th Avenue or 10th Avenue, and then the Hudson River, followed by Jersey, Kansas, Utah, the Pacific Ocean, and then China, Russia, and Japan, which really kind of highlights like what is most important to that individual in the present. And when we're making kind of tier one decisions, what is most important to the consumer or the person that will eventually implement that kind of intervention from a database decision making? Is it going to be an effect size, or is it going to be how much does this intervention cost, or how many teachers it might take to implement? The things that we all need to be considering when implementing school-wide practices. So the next step in this process is this idea of kind of what's in the building. I always start with resource mapping, determining who can implement, and ultimately determining how many kids in a particular building might need some level of support as aligned to an MTSS. One simple resource to do this on the next slide is a simple 2x3 intervention matrix. Now you see there, this is aligned to the social, academic, and emotional behavior risk screener. Substitute your favorite screener, substitute your favorite tier one data source. And really what this allows a interventionist or school leader to do is before a single piece of tier one data are collected, you're already thinking about how are we triaging our intervention supports into different buckets. So here you see the three buckets being social behavior, academic behavior, and emotional behavior. And this could be done at tier two, or let's say for our purposes, the classroom level, and tier two plus, let's say for the small group level. And then on the next slide, we break that down a little bit further, and you can look at kind of how we can do this. So again, before a decision is made on any kind of intervention at the tier one or tier two level, you're looking at not only what we have available to us, but who we have available to us, how much time they might have available, where the intervention is provided, and what kind of resources do we need to really make this happen. And on the next slide, you see a more detailed example of some of the different domains, the intensity of that intervention, again, matching the intensity of that student need. What is the overall goal or intent of this intervention? How long it takes, and the various grade levels. So when schools are thinking about how are we starting at the tier 1 level to make those decisions that follow a screener or a review of disciplinary data or any other kind of tier 1 source of data, they already know, they don't have that decisional paralysis because they already know what's going to happen next, and that we have the adequate amount of staff, we have the adequate amount of time, resources, interventions to make this happen. So in the next slide, you're going to see an example of a resource map for MTSS planning. On this slide, you can see decision rules that might fit, and I'll talk a little bit about some decision rules in a few slides. But who is going to be part of this team at each level, from the tier 1 all the way through the tier 3 process. So the next step after doing some initial resource mapping is having a conversation around what's in the building. So at this meeting, the team might just say, all right, well, what is the serviceable base rate of risk? For our purposes, we'll define a serviceable base rate of risk as some level of need within a building that can be serviced by the current, and I emphasize current, level of staffing, resources, and time dedicated to any particular intervention or service. The one way to calculate this, and doing some back of the envelope math here, is that we might have 5 teachers implementing the good behavior game in the classroom, let's say for 20 minutes a day, 10 minutes, or 10 student service team members serving as check-in, check-out mentors. We have a school psychologist, counselor, or a social worker implementing an 8-session, 45-minute brief coping cat, and 12 teachers who are trained in the HOPS intervention, but maybe not currently implementing it, although they have the time available to do that. Now, a school team at the tier 1 level would then look at this and say, all right, in sum, we know that we can serve X number of students across these different service providers as well as time, and saying at the school level, let's say we have a school level or a school of 1,000 kids, maybe we can serve up to 200 students at a tier 2 level. So calculating all these kind of resources together, we'll know how many total students that we can serve at that next level of intervention that goes kind of beyond what universal curriculum might be provided. And so in the next slide, we'll show you kind of how to determine that moving forward. And so when we're thinking about kind of how to use universal screening to facilitate this process, again, it's really important to, before doing anything, is establish what is that serviceable base rate of risk. And as I mentioned in the last slide, that's kind of how one school team did it, is they kind of looked at all their resources available, all their tier 2 resources available, and said, this is how much we can serve. Oftentimes within an MTSS triangle, you see your 5, your 15, and your 80. I've worked with a lot of schools. I'm not sure if there is a 5, 15, 80 school out there, right? We know there's, of course, some pretty wide variation in the needs of any particular school building that we work with. And so it only makes sense to understand the local resources available before making determinations around what kid might need a tier 2 level support at the classroom level versus small group. And so by setting a school-wide base rate, again, for the example in front of you, you see that to be 20%. And any level of risk or need based on your review of tier 1 data that's above 20%, well, that's a tier 1 problem, a tier 1 that could be addressed at the systems level. Diving a little bit deeper is when we have a school-wide base rate of less than 20%, now we're able to target individual classrooms. This is the most kind of efficient way to use limited resources. Why target, for example, all 5th grade teachers when only a certain number of 5th grade classrooms might need that level of support? And so if that base rate at the classroom level is above 20%, that's a classroom type of intervention, something that we can implement at the classroom level. And only when we see school-wide base rate and class-wide base rate below that set threshold, that's when we start to do that individual small group support at that tier 2 kind of level. So that's, again, kind of a threshold base rate kind of model of how we make those decisions using that tier 1 data and implementing into tier 2. So now I'm going to turn it back over to Allison to talk a little bit more about tier 2 screening and progress monitoring.
Thank you. So as Nate mentioned, the savers, a lot of schools will use that as a universal screener, meaning every kid in the building gets screened, and that's going to identify students who have needs in different domains. Another example is the strength and difficulties questionnaire that, like the savers, identifies issues in different domains. Now, the reason that I like those both as universal screeners is because of the domain identification, because it can be used to match kids to appropriate interventions. So not all kids need check-in, check-out, although it might be effective for, I think the estimate is about 70%. These days, there are another pocket of kids that can benefit from a different type of intervention. And so having universal screening data is really important for identifying those issues. However, I realize that some of us live in states that are where we're up against some issues related to universal screening. But if you don't have universal screening in your schools, you can also screen kids who have been identified for tier 2 through other methods. For example, if you're looking at attendance data or office disciplinary referral data or grades, or hopefully a combination of all those things, and you say, okay, this kid has some risk. And then we administer the assessment to determine where does that risk lie? Is it in conduct problems? Is it in hyperactivity? Is it in emotional symptoms? And then again, we can match kids to an appropriate intervention, and how we've deemed those appropriate is based on what the research says is effective for helping certain types of problems. For example, kids who struggle with hyperactivity and inattention could really benefit from learning self-regulation skills. So giving them goal setting strategies, self-monitoring strategies can be really effective in the classroom. Once kids have been matched to a validated tier 2 intervention, then we begin another database decision-making process called database individualization, or DBI. This process involves collecting progress monitoring data to determine if a student is responding positively to intervention or maybe not at all. One of the tricky things with tier 2, especially as it relates to behavior, is that there really are no strict guidelines or decision rules about how much data we should collect, how we determine if intervention is working or not. That's a lot different than doing progress monitoring for academics. And so we rely a lot on guidelines from the single case design research. We do not, however, rely on how we feel in our heart or the data in our gut, or otherwise. So we do have to collect some data, and there are several different ways to do that. I want to talk really quickly about 3 different methods. One is the direct behavior rating. This is simply a rating of students' behavior on a 0 to 10 scale. And so ideally, a teacher would be able to do this. They would identify the observation session. So it might be during, a 45-minute math class, and at the end of 45 minutes, after the teacher has done the lesson, math is over, then they rate the kids' behavior on a scale of 0 to 10. The standard direct behavior rating form has 3 behaviors, and I think academic engagement, respect, and disruptive behavior. So on disruptive behavior, obviously want a lower score. But you can do single item behaviors. So pick one behavior that the kid needs to work on. You can fill in your own behaviors, but it's really pretty simple. Another type of data collection, which sometimes we talk about as being the gold standard, although there are some issues with it, and it's certainly more time and labor intensive, is simply direct observation. And so what that means is that an outside or external observer, or it could be the practicing teacher if the intervention is in the classroom, is going to measure student behavior in real time. And so for teachers who are doing this in a classroom, I really think there's probably only 2 feasible ways of doing this. So one is a simple frequency count, the number of times a behavior occurs. So for example, if a teacher were looking at the number of times a kid blurts out, they could simply make a tally mark, and that's going to give them an indication of the behavior. And then momentary time sampling where you set a timer on a certain interval, and then when the interval is over, you look up and see, is the behavior occurring or not occurring? And so there are different like timing devices or prompts that teachers can use to do that. That's probably these are the most practical and feasible ways to do this in a classroom. And then the third way is what I like to call intervention-based measures. And these are data that are collected within the intervention. So some manualized interventions have assessments that accompany them. So some of the cognitive behavioral interventions or social skills interventions have built-in tools that are supposed to be collected, you know, once a week, and those data can be used as a progress monitoring tool. Those tend to, again, occur with more manualized interventions. As we think about the DBI process, however, and we're looking at our data to determine, you know, are these progress monitoring data telling us that this intervention is working for this kid or it's not? We also really have to consider treatment fidelity. And so I like to think about fidelity as taking your medicine, and we need to have measures of fidelity. So was the intervention implemented as intended? And it's really like almost like a medicinal label. So on those labels, they're matched to need. They tell us how much and when we should take them, what the intervention should look like. They also tell us to finish our medicine. So take the entire dosage. So we don't want to stop before all of it's been taken, because then what happens? Whatever ailment could potentially come back. And so as we think about what those data mean taken in conjunction with the progress monitoring data, it's really going to tell us how accurate our decisions are about whether kids are responders or non-responders, and then what we should do. So if we look at our data and see that the student is responding to intervention, but the intervention is not being implemented with fidelity, there are likely factors outside of the intervention that are contributing to students' improved behavior. So for example, if you have a kid who just made the basketball team, and let's say they were really struggling in class, but they have to be eligible, academically eligible, they can't have any office discipline referrals or absences in order to continue on the team, making that team might be the actual intervention. It doesn't really matter that they're also participating in check-in, check-out. On the other hand, if the student is responding and the intervention is being implemented with fidelity, then we want to begin to either fade the intervention or keep doing what we're doing and then fade a little bit later. That's for a responder. We don't want to quit cold turkey. Doing that is not a good way to ensure that behavior or change is going to maintain over time. And then if you go to the other side of the slide, if the data indicate that the student is not responding and intervention is not being implemented with fidelity, then before we refer a kid to another intervention or further diagnostic assessment, it may be that we need to provide further training and coaching to the interventionists. And then finally, if the intervention is being implemented with fidelity, but the student is not responding, then we have a non-responder. And so we can make some adaptations to the intervention. We can potentially change the intervention or refer the kid to a different type of intervention, or we could conduct additional evaluation. And so it's just really important that we don't just look at progress monitoring data in isolation, that we also include treatment fidelity data before we refer a kid to tier 3. So I'm going to turn it over to Betsy to talk about tier 3.
Great. Thanks so much, Allison and Nate. Tier 3, in my view, is really about addressing the behavioral and mental health needs of individual youth, those individual kids who continue to struggle and cause a lot of difficulty for their teachers and their parents and their peers. And I want to emphasize that assessment and interventions happen in context, right? They happen in classrooms and in hallways and at lunch and recess. So the context is very important for assessment and intervention. We know that our youth have many strengths. Kids have many strengths that they bring to school, and their needs can be complex. Their needs include externalizing problems such as aggression and rule-breaking behavior, and internalizing problems such as symptoms of depression and anxiety, and some kids can experience both. Evidence-based interventions can address youth needs, as we know, and we use the data to help us make decisions. But youth with disabilities and youth from diverse backgrounds are more likely than their peers to experience exclusionary discipline, suspensions, and expulsions, which are not evidence-based. So if they're not in school, then they don't have access to evidence-based intervention. So we want to implement these strategies that help keep kids in class and learning. And as it turns out that all of you educators who are teachers, school psychologists, social workers, counselors, nurses, and I also want to add principals and assistant principals because they can allocate the resources for intervention. All of you do have the tools to address youth needs in the settings where they occur. Therefore, adults, set goals, and principally to build, sustain, and repair positive relationships with students. Use those low-intensity interventions frequently, and you can have a colleague observe you to see how you're doing with high frequencies, for example, of behavior-specific praise and instructional feedback. These are interventions that are extremely effective, setting clear expectations, using behavior-specific praise, student choice, behavioral momentum, and active supervision. And all in working with students who have challenges and complex needs, keep an open mind and practice mindfulness in the moment. Adults, mindfulness is for you. You can practice mindfulness in the car, on the way to work, in interacting with a student with significant behavioral challenges. Pay attention to your breathing, entering and exiting moment by moment. And you can practice these strategies rehearsing a favorite lyric from a song or a favorite line from a poem, but do it frequently in order to calm your nerves, especially if a student is challenging to work with. Now, back to context, I really liked the points that Nate and Allison made. One is what's in the building, right? What's in the building are these local resources, your team of experts. And you always have the ABC analysis at your fingertips, which really forms a basis for assessment and intervention. And this ABC analysis then also lets you decide and determine based on the data how effective the various interventions are, because you're implementing more than one, right, for students in Tier 3. So this is a really common phenomenon that you'll recognize. Setting events where, in this example, you have a 10th grade student who has a part-time job and friends outside of school from work, and the teacher hasn't developed a relationship with this student yet. It's early in the year. This is Algebra 1. It's a high-stakes class. The student's not a fan of algebra. The student took out pre-algebra last year and is tired from working the night before, has his head down. Teacher's also tired. I mean, we're stressed these days especially. And the teacher asks students to begin work on their assignment. The student lifts his head, replies loudly, "You can't make me do this, beep." And teacher says, "Student, you need to leave the class now." The student receives an office disciplinary referral and in-school suspension. The student misses opportunities to learn and pass Algebra 1. So this episode is maintained by escape both for the adult who then doesn't have to deal with the student's difficult behavior, and escape for the student because then he doesn't have to sit through algebra. So let's turn this context around and look at examples of interventions and assessment opportunities that can prevent this kind of outcome that we just talked about, that can change the trajectory. So the setting events, the antecedents prior to the behavior are absolutely critical for preventing behavior problems, right? Relationship building strategies. We know that if we greet every student at the door as they come into class, that briefly, that's extraordinarily effective. We know that if we establish, maintain, and restore relationships, that's also an important process. That, you know, if you have a negative interaction with a student, which happens, I mean, we're all human, you need to take the time to restore that relationship and spend time with talking with the student about things that don't have anything to do with school. Reconnect to repair any harm from any prior interactions. And then this is a great place to have the check-in and check-out intervention in place, because not only does it help students with relationship building, responsibility, and so on, it's also one of those data collection within intervention tools that Allison was talking about. So now we're in algebra class. The student's still not a fan. The student and teacher are both still tired, but we're setting a different antecedent. We have peers working together, and we know from PALS, Vanderbilt, and others that this is an extraordinarily effective way to engage students to increase their motivation. It has to be structured though, right? We don't just put kids together and say, work on your assignment. We have clear expectations. We set the peer pairs up carefully and mix them up frequently. And that, you know, is different from saying, go work on your own after I explain how to do the math. All of these preventive efforts can prevent what could still happen, right? Everybody has a bad day. And let's say if the student says, you can't make me do this beep, then Kent McIntosh has tested an intervention at school-wide level that we can test at the individual level with our students. And that's called identifying a vulnerable decision point, recognizing that, okay, the student has just, you know, had a little explosion there and I'm tired. But what I'm going to do is I'm going to practice mindfulness. I'm going to stop. I'm not going to do anything right away. I'm going to take a deep breath, observe with an open and receptive mind with what's going on, and proceed positively. Give the student space, ignore the behavior, but praise and attend to others who are on task and engaged, and then speak to the student privately in a few moments, like, you need to check in with me in a few minutes, but continue to give the student space. Also use the tool of behavioral momentum, where you might ask a student to get up and pass out some books or collect some material, something physical that's, you know, easy to do, and give the student options. Continue to attend to peers who are engaged and praise them frequently. The whole goal here is to keep the environment calm and follow with a restorative consequence later. Maybe the student has to come back to class and help you, you know, with some service project in class, or help, you know, as a way of restoring the environment without it being this exclusionary punishment. But the result is that the student stays in class and learning. And then throughout this process, you can use the tools that Nate and Allison have been talking about, like the DBR, like what percentage of the time was the student engaged in class and learning. You can use your obviously the ODR. If the student is not excluded from class, then that's a win. You're reducing that outcome in particular. And then sometimes with behavioral and mental health interventions, we forget to focus on the academics. Like, how is the student progressing in class? That's where the rubber meets the road. That's the most important thing for them. So we want to collect that data and share it with the family members in particular as well. Finally, I wanted to share really quickly McIntosh's finding from a group design study, which he and his colleagues did on the eve of COVID in, I think it was 8 schools in the Southeast, who had high rates of disciplinary exclusion for Black students in particular. And what they found was that this vulnerable decision points, stop prompt, mindfulness strategy really significantly reduced the office disciplinary referral risk for Black students who were in the treatment compared to those who were in the control group. So you see from 2018 to 2019, that black bar on the graph significantly reduced from 2018 to 19 to 2019 to 2020. So it's very promising. I encourage you to practice it, and a little mindfulness goes a long way. Finally, I just wanted to briefly conclude with a comment that MTSS framework is a game changer. I started in the field before we had this framework, and I know that there's variability in implementation in schools across the country. As I said, I've worked in urban schools and rural schools, and having enough personnel, having enough teachers and staff is a perennial challenge. But we do have the resources in our schools in terms of the human capital, the teachers, the special education teachers, the principals, the school psychologists, social workers, reading and math specialists, whoever we can bring together to look at data and make decisions on behalf of our kids. Thank you.
All right, thank you, everyone. We're now going to transition into our panel portion of our webinar. So if you haven't already, feel free to submit a question for either a specific panelist or just all of them at once through our Q&A feature. And I see a few have already come in and have been answered via text, but I have a few to get us started. So our first question was for Allison, which was, were the assessments that you were discussing meant for general education, or will they be helpful for emotional support classrooms as well?
I think they can be used for both.
Okay, great. Then we have a question. I'm going to do the specific ones first, and as they come in. So then we have a question for Nate. Oh, I'm still sharing. I'm going to stop sharing. On base rates. So the first is, how is base rate calculated?
Yeah, that's a really great question, one that's not necessarily a very specific mathematical formula. Rather, a school team first should start with, all right, how many available individuals within a building is able to serve a particular level of intervention need. I usually start at the classroom level. So for example, we might have 10 teachers who have the ability to serve 5 kids per week with check in, check out, right? To be a check in, check out mentor. You add that to, let's say, a school social worker who can run 3 intervention groups or something like that to calculate your kind of more individual levels or small group levels of supports. And so throughout this process, as you're kind of looking at both the personnel, their time available, and what type of intervention they can calculate, a school team usually gets kind of a back of the envelope number as to how many at the school level could we possibly serve at the next level of intervention. And that's the key point, is that's going to be a little bit different for every school, is what is that next level of intervention? We always recommend starting at the classroom level and then the small group level. If that's the case for your school, it's the idea is, how do you calculate how many kids you can serve at that classroom level, and then you divide that by the total number of kids within that particular school building. That'll give you your base rate. Anything above that number really should be a tier 1 kind of challenge first.
All right, thank you. So now this question can sort of go to anyone, but I'll pass it to Betsy first. What is the best time for elementary and secondary teams to meet as part of database decision-making processes? How often should teams review and analyze data for students with intensive needs?
That's a great question. I think some of the school psychologists and teachers I work with will say, oh, we meet every 6 weeks. And that's not often enough, right? At the same time, maybe once a week might be too often. It depends on the student's needs. I observed some work in Rhode Island at one time in a school where they had a really systematic process where they actually hired subs to go into the class. I know that can't really happen everywhere, and bring teachers in to discuss the data with the school reading specialist in this case, and the special education district coordinator. Is really a well-oiled machine. But I think that overall, probably more is better. Once a week might be too much, but frequently, especially for students who have intensive needs, even if people do it briefly, I think that's really important point, right? Spend a little bit of time more frequently than hours, less frequently. I don't know if Nate or Allison have thoughts on that.
Yeah, I would agree. I think there's a fine line between kind of how meeting too much relative to the decisions that follow. If you're finding yourself making consistent decisions over and over, it would seem like that those can be collapsed into an every other or even more or less or even less frequent meeting.
I think just speaking at the tier 2 level specifically, that making sure that you have enough meetings. I mean, nobody wants to have more meetings, but if you don't, one thing that I see is kids and it being almost like a life sentence to check in, check out, for example, and then you get bad fidelity, you get intervention drift, where kids are just basically filling out a point sheet instead of there being any feedback. And we know the point sheet is not the intervention, it's the feedback, it's the interactions with the adults. And I think to ensure that you're getting best fidelity, you have to meet to review the data and make sure that you're identifying if the kid is making progress, and then be able to make adaptations. Because you don't want a kid in a tier 2 intervention for 8 months if you can avoid that.
I agree. And I also think that teams can get better at this. I mean, we've seen this mostly through reading intervention research, but you can always practice and get better at quickly making decisions and say, oh, this kid, he needs, get out of check in and check out and move on. So that's a goal for your team as well.
Awesome. So we have a few questions around low frequency low frequency behaviors, and then low intensity behavior strategies. So the first one is, how can educators effectively make data-based decisions around low frequency but high intensity behaviors? And what specific data should teams be focusing on in these cases? For anyone.
I mean, I guess those behaviors are the kind that get you thrown out of class and thrown out of school, right? So fights or turning over a desk or throwing things or aggression, So what was the question again? I'm sorry.
No, you're fine. What specific data should teams be focusing on for those cases?
I think goes back to the ABC. So the ODR, the Office Disciplinary Referral, is the kind of the red flag that's and grades and other data that Allison talked about. But then what's happening in the interactions with that student and in the setting. And I also tell my students to look for places where the student is being successful. Are there other classrooms where this isn't happening as often? What is that teacher doing? And are there things you can do to replicate in the troublesome setting? So I really think that deep dive into context is invaluable as far as those observations. And this is where, if you have school psychs, if you have social workers, having someone come and observe for you is invaluable.
Yeah, I would just echo the piece of observation, because with a low frequency, high intensity behavior, ideally you observe the behaviors that are happening or the triggers that are happening in the environment before that high intensity behavior happens. And sometimes that's going to take an outside observer to kind of figure out what are the predictors, and then how can we intervene before that happens.
Great. So one other attendee says, I like the idea of low intensity behavior strategies. How do you support widespread use of these, particularly when teachers say, I already do all of these things? Nate, if you have thoughts, I'll pass it to you first.
So the gist of the question is how to do low intensity interventions more frequently.
Especially when teachers say they think they already do all of those things when maybe they don't. So how to approach that situation?
I think the first question to ask is it working for you? I mean, we can go in all reality and say, you should do X, Y, or Z. But that doesn't necessarily mean they could do X, Y, or Z. So if it's working for them, then very little of what you recommend is going to be implemented in all likelihood. I mean, if we're being real here. If it's not working for them, then you have an opening of saying, all right, well, why isn't it? What are some of the barriers to what you're doing in terms of its effectiveness? Is it not being done with fidelity? Is it not being done with the right amount of intensity or frequency? So I would rather start, instead of recommending something new, with like what's happening now and identifying some of the barriers to using existing resources, existing routines, or existing practices, and trying to enhance those effectiveness before trying to do something that's replacement.
I think a really simple strategy is for like praise, for example. A lot of teachers think they praise a lot, but when we go and do observations, the rates of praise in gen ed classrooms in particular are really low, and having them self-monitor their own praise can increase the use of their praise. And so that's a simple strategy. It's like they're collecting data on themselves. And, you know, that can work for any kind of, I feel like I'm preaching fidelity today, but a fidelity checklist of those strategies is often a prompt to do the strategy. And so those are kind of simple ways to get implementation improved.
I think it can also be linked to those relationship building strategies, right? So if you're, talking to a student briefly when they come into class every day, or if you're, just making a point of having a very brief conversation frequently about something outside of school, then you can also encourage the teacher to pay attention to that student when that student is engaged and on task, and create opportunities for behavior-specific praise in particular.
And we have one question coming for Allison. Are there gentle ways to request teams collect fidelity data if a team gets defensive when questioning the integrity of the data?
You asked that question so gently, and I don't know. It depends on who's doing the requesting. Is this from like a parent? Is this a member of the team? I don't know who asked that question, but
let me see if I can. Someone else was also, I think, along the same lines, looking for tips, just more generally about collecting accurate data when teachers feel too overwhelmed to track data in the classroom. So kind of how to approach that situation or support teachers in that way to help them collect that data.
And is this for monitoring behavioral progress in the classroom or fidelity data?
It doesn't say, so I think either way you want to take it, whatever you think.
Yeah, I mean, I think if we're talking about behavioral data or student data, I mean, it might not be behavioral, it might be related to anxiety, like the GAT-7 or something. If it's too overwhelming for a teacher, which I understand because they have so much on their plate, and this can feel like one more thing to do, is to take advantage of the resources that may be available in the school. If there is a tier 2 team or a tier 3 team that could potentially provide support, or an instructional coach or a behavior specialist or a school psychologist that would be willing to come in and do some periodic observations, that might be helpful. Or pairing with a university, if that's a possibility, because there are always people available at the university level who want to come in and work with teachers and provide even just coaching and support on that. And the thing that I've found too is that after they've received some ongoing coaching and they build some self-efficacy, then they feel more comfortable doing it independently. But asking somebody to do something like with little to no training or coaching is not really fair to them.
This is another great question that I'll pass to Betsy first. What is the role of student self-reported knowledge, attitude, skills tests in determining the success of an intervention?
I do think it's really important to get student feedback. We underappreciate the feedback that students can provide, whether it's that particular reporting or another form of reporting. Somebody else had asked a great question about internalizing problems. So you think, externalizing problems, aggression, acting out behavior, cursing, or what get kids in trouble. But, we know that anxiety and depression are on the increase among kids, especially adolescents. So these two answers can be connected. I think that on the notion of internalizers, paying attention to kids who are withdrawn, who are missing a lot of school, who have, symptoms of anxiety that you can observe are really important. And you're going to get that from the kid, right? I mean, the kid is going to be able to tell you that. If you're concerned about the kid, you obviously want to check in with the family, but the kid can respond to a Google form privately confidentially about how they're doing. And as Nate pointed out, that might be opportunity to introduce the possibility of screening, so the kid can get more resources. But I think that listening to the kid as a source of data is really important. We underuse that resource.
Anyone else have anything to add for that one? All right. So the next question that I want to make sure we get to, and I want all three of our panelists to answer, is do you have any advice for supporting students with mental health challenges that schools or teachers could implement immediately? What are some actionable steps they could take tomorrow? And we could start with Nate, or if you're not ready, that's totally fine. But we could start with you and go down the line.
Honestly, the first thing I always start with that you can do today or tomorrow is simple, are you okay? I think so often, whether that be the student or quite frankly, the educator, those kinds of simple communications of concern for somebody's well-being get overlooked. So starting the conversation with are you okay? How can I help? How are you doing? It's just a really, I think, important first step to starting a relationship that would be necessary for any further well-being levels of support.
So I think Nate said the key word there is relationships. And so building relationships with students is I think the best way to support students with mental health challenges, because when you build that relationship, you're more likely to observe when there's an issue, and they're also more likely to come and talk to you when there's an issue. But I also think it's important for teachers to realize you're not school mental health providers. You don't have backgrounds in counseling or social work. And so that's not the expectation, but there is an expectation to build relationships, talk to your students, get to know them. And then when there is a problem and they come to you, that you know where to go in your school. Who can you refer that student to?
And as far as informal observation goes, I mean, observing the student interacting with peers, I mean, peer or not, right? I mean, do they have friends that they hang around with at school, even one friend? And if not, then could be a concern, right? So depending on the person, right? But I think that's a good, important piece of information to collect too.
Yeah, as a school psychologist, certainly we work with students on an individual level about their mental and behavioral health needs, and yet we don't see a student, of course, nearly as frequently as an educator or classroom teacher. And so I think having educators, not to be psychologists, as Allison said, but with building on what Betsy said, is the relationship piece and understanding kind of the highs and lows. Is this a typical day? Is this just a middle schooler being a middle schooler? But being on the front lines of knowing when something might get to the level of concerning and then referring out is the absolute critical piece.
Great advice. Do you have any resources for collecting data from home visits?
I would say the parent ratings, good parent self-report. Or if you're trying to see what's going on in the home, then there are family assessments that are available.
Yes,
Right.
I mean, some of the screeners have parent report, as Betsy was talking about, like the SDQ, there is a parent version if you wanted to collect that from parents. ABC data collection in the home is also another good thing that can be done.
We do have a question on the process for fading interventions, which I don't think we have time to fully get into that and decision rules, but there's an aspect of the question I think is interesting, and that says, should certain interventions never be faded? And they used an example of behavior-specific praise.
Yeah, I would say at the universal level, yeah, I mean, that's just a generally good practice, right? But praise as a standalone intervention doesn't, I mean, that for tier 2 and tier 3 wouldn't necessarily be a thing, right? Like we're going to do that universally at tier 1, but for tier 2 and tier 3, if it's a component of a multifaceted intervention, that might be something that we fade out a little bit. I don't know that you ever want to get to 0 rates of praise, because we want to encourage that. But yes, I think that is a component that can potentially be faded when it's part of a multi-component intervention.
Does anyone else have anything to add? We're closing up shop here in our last 1 or 2 minutes. Or panelists, do you have anything else you want our participants to know?
I guess the last thing I wanted to say is that, you know, a lot of kids don't receive mental health interventions, like probably the majority of kids, even though schools are the place where they do receive mental health interventions. So I think that there's a lot that we can do as educators to support kids' mental health, right? All the things we've been talking about, relationship building, behavior-specific praise, so on and so forth, effective evidence-based interventions. Those packages of interventions are going to help support kids' mental health. I think of it as akin to Michelle Obama's Next Move project, right? That's kids' physical health. Well, how can we support kids' mental health in a global, universal way? That's my last word.
Thanks, Betsy. I'm just going to turn us over now to our evaluation survey for this event. So thank you all for coming. I know Amy put the link to the eval survey in the chat, but you can also scan this QR code. This is just so we can keep improving our webinars and our workshops. So we really appreciate you all coming today and learning more about DBI and mental health. And thank you so much to our panelists for being here and all the hard work that they put into this presentation.